of overlaps between the last two speakers and what I have to say. So I hope you don't get bored. Like Art Kaplan, we were colleagues 50 years ago at the Hastings Center in the United States. And we're the only two people so far who haven't had a visible presentation. So you'll just have to listen to what I have to say. Skepticism and denial regarding scientific theories and facts has always existed. A couple of brief examples. One key example is the heliocentric universe. For many years, the common belief was that planet Earth was the center of the universe. The idea that the sun is the center of the universe was put forward by Copernicus in the 16th century, and initial reactions were skeptical, but were soon accepted. A more recent example is Einstein's theory of relativity. Other scientists strongly opposed his views when it was first announced, but eventually Einstein's theories were accepted by leading scientists and physicians providing healthcare. According to one article, quote, "The spread of misinformation is not new, dating back at least to the early days of printing. Even the term fake news was first coined in 1925, 100 years ago. The growth of the internet has, however, initiated a fundamental change." Now that's the end of the quote, and I'll come to that point a little bit later. Today's public skepticism of science and healthcare is illustrated by the anti-vax movement against vaccines, which denigrates and rejects vaccines that, as we all know, can prevent or mitigate the severity of infectious disease. This skepticism is directed mainly at vaccines to prevent COVID or reduce its severity, but opposition to other vaccines did exist throughout history, and certainly before the COVID pandemic, yet was relatively rare in industrialized countries. This skepticism is not limited to people with poor educational background, as we know, and a leading example of this, people with a higher educational background, is Robert F. Kennedy Jr., the son of the original Robert Kennedy. He is an environmental lawyer who has announced his candidacy for presidency of the United States on a third party, not the two main parties, Democrat and Republican. And Robert Kennedy Jr. has espoused other public health conspiracy theories, as well as his opposition to the COVID vaccine. So this is not limited at all to people who are uneducated or less well educated. Now, a different type of skepticism has arisen when scientific hypotheses become intertwined with politics. So I'm going to say a few words. We already heard some of this. A leading current example is disagreement over the origins of the COVID pandemic. This example shows that skepticism regarding scientific matters is not limited to non-scientists or poorly educated members of the public. In this matter, both scientists and politicians this hypothesis that the pandemic resulted from a coronavirus that jumped from an animal to humans in a wet market in Wuhan, China. Others argue that the virus was created in a Wuhan scientific laboratory where a branch of the United States National Institutes of Health, the NIH, was funding research. This has resulted in American political parties and their adherents taking sides on the question of the pandemic's origin. The answer remains unresolved today due to a lack of cooperation by governments. This example shows how existing international tensions can affect the ability of scientists to collaborate and share information. Evidence exists that scientists in China initially hid information about the origin of the coronavirus soon after it was evident that there was a pandemic or a serious disease. As a result, an international team appointed to study the origins of the pandemic lacked full information. That is because the parties didn't give their full information. Subsequent efforts to obtain more information from China were unsuccessful, But Chinese scientists were not the only ones who denied the Wuhan laboratory hypothesis. Anthony Fauci, a leading US scientist and head of a key branch of the National Institutes of Health in the United States, was accused of hiding or falsifying information about work that the United States funded in that laboratory in China. I don't know what Fauci is saying today, but this is previous news since this debate began. The Chinese cover-up quickly extended to US academics who had conflicts of interest. And prestigious medical journals and media personnel also took a stance on this matter. While China covered up key information about the Wuhan laboratory leak, top US scientists were accused of lying to a congressional committee investigating the matter. So no one is innocent in this, no countryman. One recent article provides evidence that false and misleading information is causing poor health outcomes. Among the examples cited are following harmful advice online after a cancer diagnosis, lower rates of acceptance for routine immunizations, and the use of untested beauty treatments. So the question arises, what has led to this increase in worldwide populism, which has involved skepticism of elites? I guess that's those of us in this room, including physicians, scientists, and other authoritative sources of health-related information. My hypothesis is this: the sheer magnitude of today's skepticism is largely due to the widespread use of social media, the existence of paid influencers, as they're called, in these channels, and the emerging use of artificial intelligence. Social media and AI platforms can reach millions of people, and the false information spreads very rapidly. A distinction is made between misinformation and disinformation, which is defined as misinformation is defined as any false or misleading statement regardless of intent. Disinformation is a subcategory of misinformation created with the intent to deceive, to profit from it, or to cause harm. The use of, don't worry about artificial intelligence. I'm not going to say anything about it because that's your field tomorrow, okay? The use of artificial intelligence is exploding, as we know, and the risks are already becoming evident. An article in the New York Times is entitled, "AI-generated garbage is polluting our culture." AI tools, that was in the New York Times. AI tools can create what are called the so-called deep fakes, worrying researchers that they are becoming a powerful force for disinformation. This includes false scientific and medical claims that can be harmful if adopted. Here are a few brief examples of how falsehoods and hidden identities in social media can be seriously harmful. Because, of course, social media is filled with hidden identities, not real names of people. Example one, a recent article in the New York Times is entitled, "On Instagram, a jewelry ad draws solicitations for sex with a 5-year-old." A jewelry maker whose products are aimed at children started to advertise on Instagram. A photo of a 5-year-old girl was shown wearing a sparkly charm around her neck. The jewelry maker received automated results of the advertising and discovered that almost all of the readers of that ad were adult men. The Times learned that the photos drew the attention of convicted sex offenders and other men whose accounts indicated a sexual interest in children, or who wrote sexual messages. In one case, there were responses to the ads from many Instagram users, including 2 sex offenders who offered to pay the child for sexual acts. The New York Times investigation discovered that many parent-run Instagram accounts attract sexualized comments and messages from adult men. The parents who run these accounts and professionals in this field are known as influencers. And this, in this case, the accounts themselves called themselves child influencer accounts. So the intent was, of course, to influence. Example 2. Studies have shown that health misinformation and disinformation are widely spread on social media. One article identified vaccines as the #1 topic of misleading health claims. My presentation has some footnotes if anyone is interested in these articles. Another article provides evidence that social media was a, quote, a driver of health misinformation and disinformation related to the COVID pandemic. It's important to note that this phenomenon is widespread in Europe as well as in the United States. One article published earlier this month refers to, quote, an abundance of deceptive content aimed at voters electing a new European Parliament, spread by far-right politicians circulating on social media. There's even an independent research organization operating in Brussels called the EU Disinfo Lab. Example number 3. A group of researchers at the University of Chicago in the United States found and analyzed health misinformation of different kinds on TikTok, the media, the program. Among the things they found were a video that encouraged people to drink borax, which is a chemical compound containing boron that's sold as a laundry detergent or a cleaning agent. It doesn't have to be laundry, it's any kind of cleaning. A post by one TikTok user who has 47,000 followers tells them to make a solution of borax and water to drink daily with their morning coffee. This became known as the hashtag Borax Challenge and has more than 34 million views. Not 34 million viewers, but 34 million views, because they can tally those. An article published online in Euronews.com quotes health specialists as calling it the stupidest health trend they've ever seen. So the question is not only how to combat public skepticism of science in healthcare, equally important is the question how to control social media from conveying health-related misinformation and disinformation that is positively harmful to health. So, my view, at least the following steps should be taken. The first step is to identify the causes of the skepticism and the individuals or groups that are promoting it. A second step is to figure out ethical and legal ways of combating these causes with the least aggressive means and escalating if those steps are not effective. A second step is to figure, the third step, clearly the most challenging, is to implement effective ways of reducing skepticism, and I claim that it's probably impossible to completely eradicate it. The most effective means of removing false, misleading, and dangerous material, such as the messages that are seeking and promoting sex with children that I mentioned, is some sort of control or censorship, whether it be governmental authorities or the owners or operators of the social media platforms. A major barrier in the United States, and I know it's different in European countries, so people might be able to here to point to some examples. A major barrier in the United States and possibly in other countries is constitutional protection of free speech. The First Amendment of the United States Constitution. And numerous cases have been argued in courts long before social media existed. Yet considerable controversy exists over when, where, and how to draw the line. With the emergence of so-called hate speech, that is, this is in quotation marks, is a common term these days, hate speech, that takes place online or in public forums, United States courts have ruled that written or spoken hate speech is impermissible and subject to governmental control. So already there's a legal assessment of this. The difficulty, of course, is how to define hate speech. And I've been working on that very recently because of the invoking of hate speech all the time. And it's very clear that there is no single example, no single view of hate speech. And the same phrase or wording is claimed to be hate speech by some, but not by others. Unlike in the US, however, countries in the European Union have passed laws and held investigations to combat the threat of such campaigns to influence voters on social media and probably also on AI, or more on AI in the future. An example of extreme governmental control of social media and AI is China today. TikTok is not available anywhere in China. In 2021 and 2022, China became the first country to implement detailed binding regulations on some of the most common applications of AI. Relatively few countries have in place a system of extreme governmental control like that which exists in China. So, my conclusion, it's apparent that the rise of social media in recent decades has transformed the beliefs and attitudes of the public, or at least of millions of people, regarding science and healthcare in much of the world. The dilemma in free societies is whether and how to control social media and combat disinformation. A hard road lies ahead. Thank you.